Hello, everybody. So today for our group assignment, we chose um, cold laser therapy and muscle spasms. So today, as you can see, Michael is going to be our client, and I'm going to go through some health history. And then we also have David. Unfortunately, can't see him right now, and he is there. Okay, yeah, and he is going to be who I refer my client to. So we're going to begin now. Do you feel ready?
I'm good to go.
Okay. So today, muscle spasm. So what is muscle spasm? According to Delton E. 2008, muscle spasm is when the nerve system has taken over a muscle or a group of muscles to protect an injured muscle. So an excellent example of this would be acute torticollis. So some health history questions would be, when did this happen?
Last night.
Last
I
night.
woke up with it, so I guess last night.
Okay. And so that would be your mechanism of injury. You think it's due to sleep?
Sleep?
Do you sleep on a good mattress? Do you find that you wake up in different positions?
I used extra pillows when I slept last night. Do you think that had
Okay.
something to do with it?
We will have to see. We'll go through all these questions.
Okay.
Okay, so sleeping posture is obviously something that is indicated to this client. It can be from many reasons, sports, it could be from driving, but in this case, it has to do with your sleep.
Yes.
So, you have the elevated shoulder. So this is an acute injury then because it's just happened.
Mm-hmm.
Okay.
That hurt.
I'm so sorry.
It's okay.
So, for assessment, we're also going to go through some functional limitations. So what exactly is limiting your active daily living style?
Well, I can't brush my hair.
You can't brush your hair.
No, my gosh.
No.
I can't move my head when I'm combing my hair. I can't. Getting dressed is a pain, especially putting on a shirt.
Okay.
And eating soup has been a real pain.
Eating soup.
Eating soup.
Is that what you're going
Or
to?
cereals.
Cereals.
Yeah.
Okay, so eating. So the spoon, using the
Spoon.
utensil.
Yeah, that's right.
Yeah, okay.
Slob also.
Uh-oh. So, um, so some observations I have made is that we have left torticollis, you have an elevated shoulder, and you're having a bit of pain there, along with some right rotation and lateral
Yes.
flexion. I'm just trying to say the medical terms here, but this is what I'm observing here.
Okay.
Okay, so that's due to your sleep. Some range of motion, so I would go through some active range of motion, some passive range of motion, and resisted range of motion.
Okay.
So this would be for active range of motions. I can tell by some facial expressions how it would be, and you can let me know how it feels if it's too much.
Right.
As well, I just want to tell you what I'm going to plan to do. I'm going to see how it is pain-wise. Your pain tolerance might be different than mine. So on a scale of 1 to 10, from 0 being the least, not so much, to 10, how painful it is.
Right.
And resistive range of motion, I wouldn't be doing because it's a spasm, I think is what we are dealing with today. So,
Okay.
yes, I will have to skip that due to your impairment.
Okay.
I'm sorry. Okay, so as well, we are going to go through the peripheral joint scan and rule outs. But since we know your mechanism of injury, I'm going to go through rule outs.
Okay.
Since this is an acute torticollis, the structure is contractile and not inert, so that's a good sign.
Okay.
I am going to go through some other things here, so I can tell that,
Ouch, ouch, ouch.
okay, it's very tender, right? So we have some tenderness here, along with the temperature. It's very warm when I was feeling it because the muscles have shortened and torticollis, so that is happening as well. It is very ropey, and the tone and the texture, I would say, is normal of the skin. That would be the 4Ts.
Okay.
And then the special tests. Okay, so we do have some references I would like to bring up as well. So according to Baker and everyone else for authors and research, vascular function must be confirmed prior to treatment. since some treatment requires significant C-spine rotation, lateral flexion, and extension. These are all important things to take into consideration.
Okay.
All right, so I want to go through some impairments today, along with some CIs and modifications, treatment goals, and interventions. So I wouldn't usually say this to my clients, so I am going to just say it in the video then so that you can see this for yourself. Some impairments for acute torticollis would be pain in the C-spine. So in the muscles such as the SCM, through the palpations, it would be here. The scalenes and the upper traps, you would want to decrease the spasms and trigger points and improving positioning of the shoulder. So in this case, Michael had the elevated right shoulder. Along with some CIs and modifications, we would have the muscle actually spasming. So we'd have to do indirect techniques since the belly of the muscle is shortened, and you would work on the origin and insertion of the muscle, for instance, of the scalenes. Knowing your anatomy and palpations definitely makes this easier. You would have to know that. And then some treatment goals would be to decrease the pain in the C-spine overall so the client feels relaxed and well rested and would like to come see you again. So that's something that we have to take into consideration as therapists. We have to make sure we do our best at all times. So that is something we have to do along with releasing the spasms and the SCM of the muscles, decreasing trigger points and adhesions in the scalenes, for example. And some interventions would be, for example, the indirect techniques I was referring to earlier would be GTO, origin insertion, which we learned in Michelle's class as of this year in lab. So very important techniques. And for trigger points, stripping was a technique you can do along with compression over the trigger point. So compression, trigger point technique, and adhesions, you can do some skin rolling. Of course, you would start off with fascial and then work in through your treatment. Some passive range of motion would be mild range to prevent the spasming. You're not going to, in torticollis, get the full range of motion. That's why they come to see me, right? Because their muscles are short. So you can try some agonist contract along with the indirect techniques and GTO. So I want to bring up another reference here. So according to Baker and all of the other authors we have looked up, agonist contract is very effective and in treatment since there is relatively a few CIs and can be easily taught to clients. So they can do it on their own time as well. All right, so we've just done our treatment today with Michael. So we did get some progress. However, just to try and improve our treatment along to speed up the process, I have just decided to refer Michael out to a cold laser therapist, David. So he will be able to help me with this issue and impairment.
Hello, Michael. I was told that you're being referred to me for cold laser therapy. So let me take a few minutes and I'll describe what cold therapy laser is all about. So cold laser therapy is a non-invasive procedure, meaning that it doesn't require surgery. This means that the treatment and recovery time is greatly reduced. Cold laser therapy, it's a technique that uses a special type of laser light to heal cellular tissues. Modern technology makes it possible for many people experiencing the health benefits of cold laser, often from their own home. Laser. In 1967, Dr. Andre Mester believed in the medical benefits of the laser and became the most well-known experimenter of laser medicine. This is how he was named the grandfather of laser therapy. Since the mid-1900s, medical laser technology has evolved. So some common uses include increased cell growth. Laser photons accelerate cellular reproduction and growth. It's pretty cool. It increases your metabolic activity. So the photons, they create a higher output of specific enzymes. They increase oxygen and food particle loads for the blood cells. And that way the production of basic food source for cells, ATP, is increased. It increases the wound healing. So cold laser photons stimulate fibroblast development, and it also accelerates collagen synthesis in damaged cells.
You really know your stuff.
I sure do. It's like right off the top of my head.
Amazing.
Anti-inflammatory. They also reduce swelling caused by bruising or inflammation of joints that results in greater joint mobility. It increases the vascular activity. They actually reactivate the mitochondria in the cells. Yeah. It also increases the vascular activity, so increased blood flow to the areas. It reduces fibrous tissue formation, so you can use the laser photons to actually break up scar tissue. So tissues result with damage from cuts, scratches, burns, or even post-surgery. Stimulated nerve function. So they actually increase the nerve cell reconnections between ions to bring the area back to life, essentially, and pain reduction. So yeah, almost all systems of the laser therapy have a way of reducing pain.
Amazing.
Yeah, so in this case of your torticollis, the cold laser therapy would complement the massage therapy as it would aid in the healing factor of the muscle cells, reduce the pain associated with the muscle spasms, and just the warmth creates an overall feeling of wellness, which will trigger what's called the parasympathetic system, and it's going to let you relax further.
Right on.
Yeah, actually, sometimes when we have clients in here, they're in so much discomfort from the muscle spasms that we're not even able to palpate them.
Oh my God.
Yeah.
It's me.
I know. So this cold laser therapy is so non-invasive that the soothing relaxation effect, which you'll feel, is actually going to ease you into allowing the massage treatment sooner.
Why am I only hearing about this now?
I know, right?